Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73551, Radiologic Examination Femur, 1 view. 73552, Radiologic Examination Femur, minimum 2 views. Femur AP view. An AP of the femur from the hip's top to the knee's end. Due to the size limitations of the image detector, these projections are often performed in 2 images per view to ensure the inclusion of both knee and hip joints. Femur lateral and cross-table lateral view. A lateral projection of the femur from the hip to the knee. Due to the size limitations of the image detector, these projections are often performed in 2 images per view to ensure the inclusion of both knee and hip joints. And femur lateral view, Clements-Nakayama method. Radiology report, order exam, femur 1 view left, header a P-spot view of the left femur. History other specify, missing suture X3. Comparison, none available. Findings, 2 surgical drains are present. Scattered surgical clips and cutaneous staples. No retained sutures identified. Impression, no retained radiopaque sutures were identified. Let's look at the views. AP spot view of the left femur, that's a total of 1 view. This qualifies for CPT code 73551, Radiologic Examination Femur, 1 view left. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. In the clinical history, we see the note, other, specify, missing suture ×3. That tells us the X-ray was performed due to a surgical count discrepancy. The team needed to rule out a retained surgical item. The most appropriate ICD-10-CM code is Z48.89, encounter for other specified surgical aftercare. Use this code when the patient is being seen for routine postoperative care, follow-up exams related to healing, wound checks, or monitoring, imaging or exams done as part of expected recovery or aftercare for any surgical procedure, or when no specific complication or suspected retained foreign body is documented. The correct codes for this report are 73551, Radiologic Examination Femur, 1 view left, and Z48.89, encounter for other specified surgical aftercare. Radiology report, order exam, femur 2 views right header, AP and lateral views of the right femur. History, injury, comparison, none. Findings, no acute fracture or dislocation, no focal osseous cortical erosions, no radiopaque retained foreign body, large laceration of the anterior distal thigh. Impression, large laceration of the anterior distal thigh, no retained radiopaque foreign bodies, no bony abnormality. Let's look at the views. AP and lateral views of the right femur, that's a total of 2 views. This qualifies for CPT code 73552, Radiologic Examination Femur, minimum 2 views right. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, clinical history, injury, impression, large laceration of the anterior distal thigh, no fracture, no retained foreign body, no bone abnormality. The most appropriate ICD-10-CM code is 71.111A. Laceration without foreign body of right thigh, initial encounter. This is the most specific and accurate code based on the findings. The laceration is in the anterior distal thigh, which maps to the thigh region in ICD-10 terms, and there is no foreign body. The 7th character A is used because this is the initial imaging evaluation related to the injury. The correct codes for this report are 73552, Radiologic Examination Femur, minimum 2 views, right, and S71.111A, laceration without foreign body of right thigh, initial encounter. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.